Thank you for this possibility to present my results of this project. Okay, so it's very important to remember that I am director of this lab, MIA Lab. MIA Lab is a laboratory focused on microbiota immunity axis. And what is to change? No? Okay. 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 This is the title of my sub-project, and as you can see, the project is focused on heart failure, atrial fibrillation, intestinal bowel disease. This disease share and two very important factors. The first is the chronic inflammation, and another one is malnutrition. And so the principal aims of my study is to discover new biomarkers to prevent the malnutrition and also the inflammation by using an AI approach. And the second and the most important is to develop the chocolate bar with chocolate and probiotics, in addition to all the other micronutrients, to contrast the inflammation and also the malnutrition. And okay. And this is the different milestone, and the first milestone, and what a different deliverable associated. And as you can see, we can obtain all the milestones that we can have planned. In addition, so we can have also a panel recruitment of the people, and in particular, we have recruited and 3 years technologies, for 3 years and PhD, and for 1 year and fellowship. Okay, and regarding the bar, the realization, the development of the bar, okay, we have no problem regarding the development of the bar for the people, for the patients with heart failure and atrial fibrillation. So we can realize, and after we can test, and so this is good. And because of the first problem is it's good or no, it's because we can plan it and administration for 3 months. So it's very important the portability of the bar. So in this case we have no problem, and as you can see we can have the mixture of the dark chocolate probiotics, and in addition so we can inulina and CoQ10. And regarding the second bar, the bar for the people, for the patients with IBD, in these cases we can have more problem because we can include butyrate and omega-3, and so in these cases the bar is very disgusting, so it's not good. And so we can do testing in my lab and also in other people. So after the it's very, very hard to digest and so also to eat. And so we can change the composition, because we can, yes, okay, we can have the dark chocolate because it's very important. In addition, we can have the probiotic Simpio, but it's different for probiotic of the first bar. And in addition, we can have the change for the butyrate and the omega-3 for hydrolyzed protein and vitamin D3. Okay, and after we can obtain the both ethical committed for the both study, because we can one study include the patients with heart failure and atrial fibrillation. The second, so in these cases we can spend more time because we can change the composition of the bar, and so we can reapply to ethical committed. And now we have both the ethical commitment. In addition, so we can have one of the milestones is the acquisition of the new instrument to evaluate the cytokine profile, and so we can buy this ELA. ELA instrument is a very relevant instrument because we have the possibility to evaluate in very, very low concentration, picomolar, the cytokine profile. And regarding the second milestone, so we can have a different deliverable. The first is the patient's enrollment, and the second is evaluation of nutritional, inflammatory, and gut microbiota profile. Okay, and regarding the enrollment of the patients, you can see we can have a big disparity, because in these cases we can have no problem for the bar chocolate. We can obtain immediately the ethical commitment. Oh, immediately, so but it's for different mouse, so it's a big word. But so we can have 46 patients, and 22 is in the treatment for the chocolate bar, and we have no problem regarding the patability and so the side effect. But regarding the IBD, so we can have in 0 patients, because you have the very problem for the enrollment, because I have spent a long time to change the ethical commitment. And finally we can obtain, and now we can start, obtain in the end of the summer. So we can start now I hope, the enrollment of the patients. And this is the timeline of when we can have the collection of the samples. So we can have it on T0, when we can have the enrollment of the patients after the 3 months of the treatment with the bar, and finally after T2 is after 6 months of the treatment of the bar chocolate. And this is the samples collected. We can collect the serum and urine, so the stools and also the saliva, because we can evaluate, for example, in the serum, I used to evaluate the parameters associated for the inflammation, so we can evaluate the inflammatory signature. Use saliva and the fecal samples to evaluate the microbiota and also the functionality of the microbiota. And finally, we use different questionnaire to evaluate the nutritional, for evaluation of the nutritional status of the patients. In addition, the BIA to evaluate also the assessment of the body. And regarding the biomarker, because one of the aims is to discover a new biomarker, a new set of biomarker. And you can see this is the different parameter that we can evaluate, for example, in the blood and saliva, and also in the stool, regarding the inflammatory biomarker. Regarding the lipid biomarker, also in fecal and blood, this is all the parameter that we can evaluate. And finally, this is the characterization of the fecal and saliva microbiota. And finally, we can evaluate also the metabolic profile of the microbiota, because it's very relevant to characterize not only the composition of the microbiota, but also the production of the metabolites. And finally, because one very important point is integration of this data, because this is a very, very big data, okay? Big in the number, but also in the complexity of the data. And so we can realize a semantic knowledge base to harmonize annotation and representation schemes for different clinical and experimental data category used in this project. And in addition, so we can develop an experimental annotation template, data type models and corresponding LTR pipelines for respective data integration, because this is very important. And so we have realized this database, and so we can put the different data in this database, more complex for me, yes, but I have the partner dedicated for this one. And so in conclusion, I want to thank the different people that we can support me in the enrollment of the patients, in particular Professor Fumagalli for the fibrillation patients, and Stefano Carinci for the for ABS. And okay, that's my unit that will support me in this project, in more other project. And thank you for attention.